Hello, good day, everybody. Good day, subscribers, new subscribers, and old subscribers. Welcome to my channel. Um, Still your favorite news. Yes, Nurse Precious. Well, before you watch this video, before you go further, go and click the subscribe button. Yes, like this video, leave a comment in the comment section if you enjoyed it, and share it. It could be helping somebody out there. So today we are going to be doing a continuation of what we've been doing before, and we've been treating STIs. Today we are going to be treating viral infections, and our topic is hepatitis. Yes, hepatitis. I know a lot of us have heard about hepatitis, and maybe we have one relative or the other who has it, and we keep wondering how they're managing it. It's not a death sentence. In fact, it's treatable, it's manageable. In fact, some don't even exceed 2 months and they're out of your system. It depends on your treatment. If you follow it up, you'll be fine. So today we're treating hepatitis. And what is hepatitis? A lot of us keep wondering. Hepatitis. Yes, hepatitis is an inflammation of the liver caused by an hepatitis virus. It is caused by a virus. It is a viral infection. So mind you, antibiotics does not work for this. A lot of us will just go to the clinic or we'll go to the nearest pharmacy and we'll just ask for drugs simply because we assume that every infection is caused by a bacteria. When you are using an antibiotics for antibacterial drug for a viral infection, in fact, you're not killing your immune system. Well, we have different types of hepatitis virus. Well, today we'll just treat 3. Now we have hepatitis A. A lot of people, they know these types of hepatitis, but they don't know the difference in them. They have differences. So today, the hepatitis A does not require treatment. It's still an inflammation of the liver, but it does not require treatment. It has a vaccine for it. There's a difference between taking treatment and taking vaccine. I don't know if you understand. Treatment is like you are taking drug to, suppress your system and then kill the viral infection. But this one, no. The only thing you do is that you just go and take vaccine for it. And in children, it's very, very good. You start vaccinating them against these infections or viral infection. It begins at the age of 12 and 18 months. So in case you have a child and you are that mother who doesn't like going for immunization, you are doing a lot of harm to that baby and to yourself in the future and to the other children, because you are exposing everybody in the family to a lot of things. Now, we have hepatitis B. This one is very, very common. A lot of people who have hepatitis today, they have this hepatitis B. It's the most common form of hepatitis virus in individuals. Now, it is treated with antiviral drugs. Yes, it requires a long-term treatment. In fact, some persons, they take these antiviral drugs for a lifetime. Yes, I said that. Some persons, they don't take it for a lifetime. Some persons could take it for like 3 years, 4 years, even a year, and they are fine. But majority of patients, they take these antiviral medications for a very, very long time. Now, hepatitis C is also treated with antiviral drugs. There's no vaccination for this one. It's not like the hepatitis A that you go and be vaccinating yourself for. As a matter of fact, I remember when I was in nursing school, where I was working in the immunization center. I was posted there, and in fact, a lot of our parents, they don't know what's up. While I was working there, as a student, young student, I saw a lot of persons. Mama, matron, I want to bring my child for HPV, hepatitis vs HPV. Yes. I was like, which one is HPV? Hepatitis vaccine. So, in fact, the matron was very motherly to us. She now sat us down, and she was educating us on hepatitis. In fact, that day we just told her, Ma, we want to take the vaccine. She said, okay. You take it in the space of 3 months, and most times you have to be, how do I put it now? It's not usually given to people that are already sexually active. Yes. So she gave us the vaccine. We took the first dose for the first month, the second month, and the third month. 3 doses. That was how we took it then. And I was now wondering, what if I didn't come to nursing school and I don't know these things? Is this how I'm going to be living my life? So please, if you are a mother, you have a child, go and vaccinate your child. Yes, go and vaccinate your child. Immunization is free. I don't know. In fact, I don't know what is wrong with some parents these days, especially mothers. I don't know if it's laziness. I don't know if it's ignorance. In fact, without without talking further, now, what are the signs and symptoms of hepatitis? We have pale stool. We have fatigue. We have flu-like symptoms. The person experiences flu-like symptoms. Unexplained weight loss. In fact, I don't want to talk much. In our next video, we're going to treat that. We have loss of appetite. There's an infection in the body. Once you are feeling sick, the tendencies that you eat is not there. It's very, very low. The probability appetite is very, very low. It drops drastically because the body is not fine. Now, what is the diagnosis for this infection, viral infection? How do you know you have it? 1, a liver function test. Yeah, I know you have the blood work. The blood work is there. You do your routine blood work, do your HIV, you do your hepatitis test, and there are a lot of other tests you do via blood, you understand. But when you want to check for hepatitis, it's still among. Your blood work is there, your liver function test is there. The liver function test, well, these procedures, they are not cheap procedures. Yes, they are not cheap. It's not for the ordinary Nigerian. The Nigeria of today is very, very expensive. So if you need quality healthcare, it's going to cost you a lot. Now, history taking is very, very important. History taking has to do with it starts with your sex partner. Have you been tested? Have you ever had it? Do you have a relative at home that has this infection? Now, if you live with a relative who has this infection and you don't take precaution and you've not been vaccinated, your probability of contracting it is very, very high. Then, ultrasound scan. In a case where the liver is infected, there's usually fluid in the abdomen. It's one of the should I call it cardinal signs you get when you are doing an ultrasound scan. The radiologist is going to tell you. In fact, once the radiologist probes and they see that, they just suspect. There are a lot of diagnoses you can get from it, but this is one of them. Now, a liver biopsy. Liver biopsy is not still expensive. So, what's stopping you from vaccinating your child? You can call it campaign for immunization. Yes, I think I will do a video on that. Go and vaccinate your child. You're going to help that child. Might not be now, it might be in the future. Now, what is the preventive measure for hepatitis? Preventive measures. 1, you have to protect yourself sexually. Yes, it's one of the major mode of transmission. Sexually, through birth, when you're giving birth, for a parent or a mother that already has it. Sweat carries it. When you come in contact with someone that has it, you're just rubbing yourself on the sweat of that individual. You are just making yourself prone to it. That doesn't mean that you should stigmatize an individual who has it anyway, but you have to take precaution. Vaccination is another preventive measure. No sharing of sharp objects with persons who has it. Complications of hepatitis. We have bleeding disorders. We have ascites. The stomach just becomes very, very bloated. We have kidney failure. We have portal hypertension. We have enlargement of the liver. We have liver cancer, and the final stage of it all is death. If you don't do any of the above, see you 6 feet. So please go and get tested. If you go and get tested, nothing's going to happen to you. After all, you're only saving yourself from future disaster. So, in case you've been feeling uneasy, you've been feeling sick, go for your routine check to know what is wrong with you. Now, in case you've already gone for your blood work and you discover that you have it, and should I say you are shy or ashamed of going to the hospital or to meet the doctor? You don't need to be. Please, for the sake of Christ, just go and get your antiviral medications and you'll be fine. You'll grow old with your children, with your family, with you, and with the society. So, we're going to end this video here today. Please, please, and please like this video, subscribe, and leave a comment in the comment section. I want to know your view on this disease condition, and if you loved this video, if you benefited from it. Thank you. See you in our next episode of Being Healthy.
Tiger, Tiger. Start